Please rise for the procession. Please be seated. On behalf of the faculty, staff, alumni of the Medical University of South Carolina College of Pharmacy, welcome to the college's pinning ceremony. We also welcome all our viewers on Zoom today as well. I am Philip Hall. I'm the Dean of the MUSC College of Pharmacy, and I'm very honored to be the Dean and preside over this ceremony. This is a special event and ceremony that recognizes your transition from the classroom and laboratory studies to the full-time advanced pharmacy practice experiences during your fourth and final year of our program. We are here today under unique and unprecedented circumstances after 2 years of a global pandemic. I want to take a moment to thank all of you, students, for your hard work, patience, adaptability, and dedication in these trying times. As well as I'd like to thank all the families, friends for their ongoing support during this time. Finally, I want to thank all the faculty, staff, preceptors, and friends of the college for all their efforts during these challenging times. As you embark into your final year of the college and into patient care, the College of Pharmacy values compassion, collaboration, respect, integrity, innovation, and excellence instilled into you these last 3 years will hopefully take a deeper root as you enter clinical care. As you make this transition, I would like to emphasize several additional values, qualities that are important to patient care. Although the desire to excel is an important quality, a highly motivated student will almost certainly have this desire. Similarly, highly motivated students generally exhibit an upbeat, positive, and energizing attitude. While book smarts are essential in didactic simulations and laboratories, now that you're entering clinical care, you must fortify your book smarts with passion. One student that I had on rotation with me struggled in their didactic portion of the program. However, on her oncology rotation, she was a superstar. Why? Passion. She wanted the best for her patients and wanted to do the best for them. She would scour the literature for the latest treatments, ask many appropriate and probing questions about what she was reading, investigate any adverse events, and humbly do whatever her preceptor or team ask of her. She not only exemplified an avid passion, but two qualities that separate the great students, clinicians, from the good ones: a strong scientific curiosity and true humility. Regarding scientific curiosity, she simply did not look up the answer in the reference text, but she went to the primary literature, which Dr. Wisniewski embedded into you as well. This is an important practice. She exerted a lot of effort and energy in the library searching for answers for her patients' clinical scenarios. This can be challenging paradigm shift for you, as so many of our clinical questions do not have clear-cut answers. Lastly, and quite notably, this student consistently exhibited true humility. She did not look at researching new treatments in the library or reaching out to more seasoned pharmacists or clinicians as scut work, but as an opportunity to help her patients. The next two desired qualities vital for success in patient care are being proactive and being prepared. Almost by definition, a proactive student is a prepared student. Many students listen during patient rounds without ever volunteering themselves to search for the clinical answer to our patients' needs. Remember, pharmacists are the medication experts. We must strive to address and decipher medication-related issues. Proactive students who are well prepared may be confident in their recommendations, but be cautious regarding the concern of being overconfident. Don't be afraid to respond, "Let me do some investigating." Again, put the patient's well-being in front of your desire to appear to have all the answers or to look good in front of the team. Healthcare is constantly and steadily growing in depth and breadth of knowledge, so now is the time to establish solid and strong habits of careful and proper queries, as you will use such excellent habits for the rest of your professional life. Responsibility and emotional maturity, qualities important in didactic simulation and the laboratory years, increase during this clinical year in your career. Responsible students understand the team attitude. They are too responsible for medication optimization for their patients, even though you will recognize that the supervising pharmacist has the ultimate responsibility. Such students represent the team well with a caring attitude and remember to treat each of their patients as though he or she were a close family member or friend. Students who accept and appreciate responsibility generally demonstrate emotional maturity as well. A realistic challenge and great difficulty is accepting the fact that sometimes the outcomes we want will not be the best. In fact, in adults, most conditions are chronic, not acute, manageable, but not curable. Our goal is always to do our best to help patients live their lives as best they can and to manage their conditions in that way. Quoting Mark Reed, "You did not study to pass the test. You studied to prepare for the day that you are the only thing between the patient and the grave." Lastly, at the end of each day, be grateful for mentors, classmates, colleagues, for opportunities, for patients and their families. Be grateful for their time and for their trust in you as you learn and grow in this wonderful profession. At this time, I would like to introduce Dr. Dave Surley, who is an assistant professor in the Department of Clinical Pharmacy and Outcome Sciences, who will discuss the significance of the pinning ceremony. Dr. Surley.
Thank you, Dr. Hall. Exactly 20 years ago last month, I finished the amazing journey that you're about to embark on. It's a journey you will never forget. Awaiting you is 9 or 10 months of real-life interprofessional pharmacy and patient care experiences. One special thing that separates your experience from mine, though, is I didn't have a milestone moment like this, a ceremonial break in the action that says, let's kind of ponder where we've been and where we're going. And, but tonight's ceremony is dedicated to that end, though, to provide you that. And it will culminate in providing you a commemorative and a symbolic pin. So let's talk about symbols for a minute. Symbols have always held immense importance in the lives of humans. They're items of adornment, they're depictions, trophies, icons, photos. We wear them around our necks. We display them on our clothes, on our walls, and on our shelves. We ink them into our skin in some cases. We place them in prominent places for others to see. These are often symbols of our faith, of accomplishments, of love, of joy, of our triumph over tragedy and adversity. They are reminders of treasured milestones in our lives. We use them to remember, we use them to reminisce. We smile, we laugh, we cry, we live and we relive these moments represented by these things. So I don't have a photo, I don't have a ceremony to look back on or a special pin that I can place on my jacket signifying my transition. But as you already know, I do have some amazing memories and stories from that time frame in my life. And again, as you know, when I educate you all, I tell them. And so I've taken you on a few of my P4 journeys and moments that have stood out to me. You may remember crying with me in class as I described the toughest of days working with Dr. Chessman in pediatric surgery. And my emotion is not related to Dr. Chessman, although she is fantastic to work with. And she's also my boss, so I have to say that. Yeah. So working in pediatric surgery, when we were treating and bandaging an 11-year-old boy with a 90% burn over his body, we knew full well that he would not live through that, but every day we spent working as though we were trying to make that happen for him. So you've listened carefully as I described this scene during my neurosurgery rotation with Dr. LaPointe, who's on stage, where I witnessed a mother kissing her young son as he was being whisked away and off to the operating room. And seemingly moments later, I'm staring at his beautiful, pristine brain, pulsating with every heartbeat, where the doctors were about to remove a small tumor so that he could live a normal childhood. Lastly, here's one I haven't shared with you. It was on my internal medicine rotation, and our attending physician was late for rounds. And so, feeling a little guilty for that, she bought us boxes of donuts and this great big box of coffee. But in her haste and speed, she opened the door, tripped, spilled the coffee onto the table, which then ran to our papers, ran all over our white coats and on our laps. Okay. That's a moment you'll never forget. You know, I did. It's like, wow, that just happened. But feeling sorry for us, the next day, she invited us to lunch at Fish in downtown Charleston. And so all the 6 of us loaded up into her little Lexus SUV built for 5. And being the youngest and most agile, I got to the privilege of sitting on top of the center console, unbuckled, hunched over, and it was awesome. Let me find out where I am here. All right. We were a team. We were working together. We were serving together. We were learning together and even having fun together. There were many such teams. These kind of experiences await you too very soon. Such memories do stay with you. They will shape your lives and your career. And in a few short months, you will already have collected some of these things. So it's fitting that we mark this day, the end of your didactic work and the beginning of your P4 experiential journey with a ceremony and a symbol, a pin to commemorate the beginning of your great adventure. So to wrap this up, I'd like you to ponder a few things. What will this ceremony, what will the pictures, the pin, and even the process of coming up here and getting pinned, what will that say to others? What will it say to you? To others, I hope it says that you've succeeded and now proudly celebrate the hard work of your P1 to P3 didactic education, that you've risen to the challenge of the rigors that this education provides. To you, I hope it says thank you for enriching the lives of the faculty and staff who've helped develop you. I hope it is a reminder to do the best you can in caring for your patients and to represent yourself, your colleagues, your faculty, your college, and your profession to the best of your ability. And I hope it reminds you of the confidence that you have to turn your academic successes here into excellent patient care. From the faculty and staff, I hope it says thank you for working hard, for being an important part of our lives, and for challenging us to become better people. Your hard work, your commitment, and especially over the last few years, your resilience is to be commended. We're so excited for you to move on to the next phase of this journey in your career. For me, it was a journey full of challenge, occasional tears, and many more victories. And it's one that I will never forget, and I trust and I know that's going to be true for you too. On behalf of our entire pharmacy family, congratulations, and we wish you the best this coming year. Thank you. I would now like to welcome your class president, Emily Parkman, to the podium for her remarks to the class.
Thank you, Dr. Shirley. Good afternoon, everybody. My name is Emily Parkman, and I've had the privilege of serving as the class president for the class of 2023 for the past 3 years. It's an honor to celebrate this very special occasion with all of you as we venture out into our final chapter of our journey through pharmacy school. When I was asked to speak at this ceremony, I honestly had a hard time trying to figure out what I could say to best convey our experience at MUSC over the past 3 years. It's an intimidating task to personally sum up each of our unique paths into just a few minutes. I also wanted this speech to be something inspiring to think about while we're advancing through the next 9 months on rotations, and this is what I've come up with. Our past few years together, we've survived floods that constantly happen downtown, a couple of hurricanes, and a global pandemic that'll likely go down in history. We have worked insanely hard, sacrificed our social lives and sometimes our sanity, and dedicated so much of ourselves to helping others. Every day we seek to actively make this world a better place through the career we have chosen, and that's not always going to be easy. With the pin we are receiving today, we will carry evidence of our successes with us. But I hope that after 3 years here, we will walk into this final year, not just with pride in our victories, but with our failures as well. Even though today is a celebration of completing the 3 didactic years of this program and to send us out into our 4th year, I hope that we can also take this time to honor all that went wrong that brought us to this point. Every failed exam, every fake patient that Dr. LaPointe told us we sent to the ER, every accidental needle stick that happened when learning to give vaccines or prepare IV bags, they all deserve to be remembered with just as much reverence as our highlights. Our past deficiencies reflect genuine, tangible growth. They reflect movement down our paths towards our future. My failures have made me compassionate and humble. They have taught me to be patient with myself and with others. They have taught me that success is not always guaranteed, especially not in healthcare, no matter how many hours you study, how many flashcards you flip, or how many pharmacotherapy chapters you read. My hope is that our failures have primed us to tackle these upcoming rotations as more diligent, perseverant, and team-oriented individuals. We are going to be asked to do things that are difficult, unfamiliar, and sometimes terrifying. And the challenges that we have faced thus far will poise us to take on these next challenges. Please embrace this upcoming year with an open mind and get comfortable with getting uncomfortable. All of your ups and your downs have shaped you into this version of yourself that will be receiving your pin at this ceremony. And I hope as we celebrate us today that you're nothing but proud of the person you've become at MUSC. Let's keep doing the things that scare us and lean on each other just as we have for the past 3 years, because doctors need doctors too. Congratulations and good luck. Thank you. Now I invite Dr. Hall and Dr. Worrell forward for the presentation of the MUSC College of Pharmacy pins.
Good afternoon, everyone. Students, please rise for the pinning ceremony. Just the first row. Mom and Dad want to see. When I call your name, please come forward to receive your pin. Leah Nicole Abbott. Shahad Al-Ghamdi. Nicole Arroyo. Mary Palmer Askins. Lauren Elizabeth Bingham. Lauren Bledgy. Edwin Earl Bost III. Cameron Brakefield. Emma Bredberg. Rachel Marie Carlton. Riley Schaefer. Larry Cooper. Vic Dow. Caroline Inez Donaldson. Christopher Devon Donaldson. Anna Claire Eckrich. Amanda Everett. Melissa Ferris. Skylar Haas. Hunter Elizabeth Hannah. Taylor Harrington. Brittany Houston. Maddie Hux. John Houston. Kylie Kim. Kayla Kleinfeld. Rosa Lee. Jane Liu. Megan Brittany Marie. Evan McIntosh. Maria Miller. Luke William Nesbitt. Corey Newman. Natalie Louise Nix. Ian Lewis Owoho Ochieng. Ifoma Okwankwo. Emily Parkman. Ami Patel. Mitesh Patel. Smit Patel. Alexander Perales. Bradley Piaskowski. Delaney Perkle. Hillary Ann Reeves. Andres Martinez Rodriguez. Jessa May Sabate. Jesse Shelton. Sierra Danielle Simmons. Mark Spangler. Edward Spivey. Kaylee Steelman. Maddie Sudra. Christopher Taylor. Melina Tyrion. Taylor Thomas. Britton Usher. Alexa Ussery. Amanda Vickers. Eric Warren. Keandres Williams. Tina Wright. Michaela Yaskulski. Tina Zhao. Students, please rise and face the audience. Please join me in congratulating the class of 2023. Students, you may be seated. I now invite Mark Lapointe, professor in the Department of Clinical Pharmacy and Outcome Sciences, to, I'm not sure what he's going to do. We're going to find out.
I was afraid of stepping on a pin over there. I wouldn't want your job, Dean Hall. It's very dangerous. Good afternoon, everyone. Miss Persay, class of 2023, I was truly touched when I was asked to lead your pledge today, especially after all the pain and suffering we may have inflicted upon you during clinical assessment. It's quite an honor. But before I do so, allow me to say a few things that resonated with me while I was listening to my colleague, Dr. Shirley and Ms. Parkman. I always dreamt to be mentioned in someone's speech once in my life and twice within the course of 10 minutes. This is a dream come true today. Thank you, Ms. Parkman and Dr. Shirley. So let's pause for a second and remember your pharmacy teenage years in August of 2021. Remember when Dr. Sterrett guided you through your pharmacy adolescence and tried to teach you how to conduct yourself in the community lab. And I like to quote Dr. Sterrett, like to go from a teenage pharmacist to an adult pharmacist. Remember in January of 2022, when you entered your pharmacy adulthood and learned that you would not have days to prepare for an OSCE or an OSCE, you would have minutes. So this is where adulthood started for you guys. And also you had to make sure that you would do no harm to my fake OSCE patient, like Ms. Parkman mentioned, or learn the consequences of your very first medication safety error. We've all made errors and you have to be highly vigilant. It happens to all of us, but I'm glad that you made your first one with us. So it doesn't happen in the real world. So you trusted us, the faculty, in the process, and you stayed in the peloton with us. For the audience, this class was obsessed with cycling for a reason I do not yet know. So you stuck together so that nobody would fall behind, because once you fall behind, it's really hard to catch up to the peloton and then your day is ruined. So to me, and I was talking with Dr. Shirley this week, what are we going to talk with the students about is, to me, to be professional is to be impeccable in your words, your actions. It's not to take anything personal. Starting in May, it's not about you anymore. It's not about your grades. It's not about your GPA. It's going to be about the patient you serve and the colleagues you're going to be working with. It's not to assume that all the medications that a patient may be taking are correct or optimal. From now on, you have to become a champion of medication safety, because if you are not that champion, nobody else will be the champion for the patients you serve. And finally, do your best every day. Treat your rotation like if you were interviewing every day. I heard that from the speech last year, and I thought it was nicely said. So do the right thing for your patients and your colleagues. Today, I hate to be that guy again. We just gave you a pin, right? But there is one more climb we have to make together in 2 weeks. That notoriously famous inpatient OSCE hill in the lab, that 2-mile climb that will lead to the summit, and everything will be downhill from there. Okay? You got the pin today, but you still have one climb to make as a peloton in 2 weeks. Okay? And I was watching my dean giving you a pin, and I just came up with a perfect case for next 2 weeks from now. And I'm just going to give you some hints tonight, or today. Picture a young male getting grossly pinned by his dean, who happened to be on Coumadin because of a congenital heart disease, with idiopathic hypertension that is uncontrolled, with a few allergies in the mix. So is that good enough for you guys? Maybe I don't want to speak too much for 2 weeks from now, all right? So we want to cross that finish line with you guys. So we are asking you guys one more big effort above pharmacy aerobic threshold, okay? Maybe that day is going to rain, it's going to be windy, but we're going to make that climb together. But until tomorrow, now is the time to enjoy the evening with your parents and your family. And tomorrow is the time to train again and to refuel for that big OSCE, all right? So I was hired today to read the pledge with you, so let's do it now, all right? So I would like to invite all the pharmacists here and those watching the ceremony through the live stream to stand as we recite the pledge of professionalism. I'm going to step away from the mic because of my French accent, because I want you guys to be loud and clear for the people who put you in pharmacy school. All right? So please raise your right hand as we recite the pledge. As a student of pharmacy, I believe there is a need to build and reinforce professional identity founded on integrity, ethical behavior, and honor. This development, final process in my education will help ensure that I truly relationship established between myself and society as I become a member of the pharmacy community. Integrity must be an essential part of my everyday life. I must practice pharmacy, honesty, commitment to service to accomplish this goal professionally. I, student of pharmacy, should develop a sense of loyalty and duty to the profession of pharmacy by being a builder of community, one able and willing to contribute to the well-being of others, and one who enthusiastically accepts the responsibility to honor membership in the profession. Foster professional competency through lifelong learning. I must strive for high ideals, teamwork, community, and protection in order to provide optimal patient care. Support my colleagues by actively encouraging personal commitment. I do oath my set forth by the profession in work means my life practice, dedication to excellence. This will require an ongoing reassessment of personal and professional values. Maintain the highest ideals, professional attributes to ensure and facilitate fundamental relationships. The profession of pharmacy is one that permits the arts to set rigid ethical standards. These high ideals are necessary to ensure the quality of care extended to the patients I serve. As a student of pharmacy, I believe this does not start with graduation, right? It's my membership in the professional college community. Therefore, I must strive to uphold these standards as I advance towards full membership in the profession of pharmacy. All right, congratulations, everyone, and students can be seated now. I would like to bring Dr. Hall back to the podium for his closing remarks.
As we conclude our pinning ceremony for the class of 2023, I want to thank Dr. Kathy Worrell, Faye Ratliff, who's in the back, the class of 2023 class officers, Amaro Bell, for organizing this afternoon's pinning ceremony. I would also like to thank the MUSC Alumni Association for providing the balloon arch outside and the gifts to the students. Finally, I wanted to give you each one last heartfelt congratulations on reaching this important milestone of entering patient care. Congratulations. Okay. There's an ice sculpture in the lobby outside of this room where you can have your photo. I know some people already did that before we started, but please take a photo with the ice sculpture. And we do also have refreshments in the bioengineering building, which is right next door as well. So we hope you'll stay, enjoy some cake, some punch, some fellowship. Have a great evening. We do have, as Dr. Worrell said, a slideshow. We'd love for you to kind of watch, and then we will be adjourned. Good job.